All new at 6, we're taking an in-depth look into what is called long COVID, a medical phenomenon that is as real and extensive as it is uncertain and unpredictable. While most of the country seems to be moving on from the pandemic, millions of Americans are still struggling with the long-term consequences of the virus, and that includes people here in our valley.
Lindsay, how nice meeting you.
At El Paseo Jewelers in Palm Desert,
You are brave enough to walk in my store?
owners Raju and Jayshree Mehta look perfectly healthy, but the couple is marking 2 years grappling with the long-term impacts of COVID.
We still suffer symptoms.
The couple endured a severe COVID infection back in early 2020. Jayshree, who has an autoimmune disorder, was in the ICU for several days and nearly died. 2 years later, both she and her husband have difficulty sleeping.
I get up at 2 o'clock or 1 o'clock and tossing and turning, which never used to happen.
And the disruption of sleep is terrible because you'll be up at any time. Some days you sleep well, some days you don't.
And that's not their only symptom.
Chest, heaviness, runny nose. You'll have waves of depression. It'll come and go.
I still don't have fully smell. I'm having problems smelling like I used to.
Are you surprised that 2 years after contracting COVID, you're still dealing with the symptoms?
We are surprised, yes. And we are surprised that, the new strain is keep coming. It's not over yet.
What was once understood as a respiratory virus has emerged for many as an all-out attack on the system. After recovering from even a mild initial infection, many COVID survivors across all ethnicities and age groups report a number of symptoms, which include persistent exhaustion, memory and concentration problems, depression, headaches, coughing, shortness of breath or difficulty breathing, and sleep problems.
It's a real challenge to overcome this monster called COVID.
Legendary photographer and Rancho Mirage resident Michael Childers also nearly died from COVID and still struggles with breathing, walking, and stability.
It's been 2 years of trying to come back. Yeah, but it's always there. It's always there, the ghost of this COVID.
According to the CDC, about 30% of people who survived COVID suffer from long COVID. But new research from the University of Michigan reveals the numbers are much higher.
43% of those infected with COVID-19 will experience some form of long COVID.
43%?
43%. That's our estimate. Correct.
That's nearly half.
That is nearly half. It's a startling estimate.
Researchers are now trying to figure out why people are impacted for so long, with more than $1 billion federal dollars devoted to studying COVID's prolonged health consequences.
We have potentially hundreds of millions of people that are experiencing this worldwide, and they need support.
Meanwhile, doctors, including the ICU medical director at Eisenhower Health, remain focused on managing symptoms.
And everybody reacts a little bit differently. Everybody has a little bit of a different course. The way you start with COVID isn't necessarily how it transpires over the next few months.
Doctors say while treatment protocols are under review, at this time there are no conclusive recommendations for medication in the treatment of long COVID. Is it frustrating for you as a healthcare professional to treat patients when there's still not a lot of information available about long COVID?
Yeah, absolutely. So we try and break down whatever data we can. But beyond that, a lot of it is anecdote.
Meanwhile, the Metas and Michael Childers are doing what they can to fight off their persistent symptoms, including healthy eating and exercise, and they have this message to others who are also struggling with long COVID.
I would recommend that you have a support system of friends, family, or there are a lot of health centers here. Make sure that you're part of something, because you have to fight so many different things.
You have to have a whole team of positive people around you to help you. I couldn't have done this alone. Just keep working on it and do physical therapy and walk. Do whatever you can to turn it around. It's your body's been through a lot.
The National Institutes of Health received more than $1 billion from Congress to study the long-term effects of COVID. More than 200 researchers are currently involved in building a nationwide study population. For more on that project, and also links to the CDC and University of Michigan's research on long COVID, head to our website, kesq.com.